And good morning, everyone. Thanks for joining us for this Monday's COVID-19 press briefing. Today, Orange County Mayor Jerry O. Demings will start with our goals for the week, as well as an update on coronavirus cases, which will include some indications as to where we are and where we stand as a county, as it relates to vaccinations and as it relates to testing. The mayor will also discuss some very important other items and issues that affect Orange County residents. Dr. Raul Pino is here from the Florida Department of Health in Orange County with important information and statistics on COVID-19 trending here in our area. We will begin with Mayor Demings. Mayor.
All right, thank you, Dr. Williamson. Thank you to all of you for being here. I hope that you had a great weekend this past weekend. Today I'm going to start with the goals for the week. Each week that we have come before you, we've tried to lay out where we're headed. And this is the 157th press briefing that we've had since we started providing press briefings to our community to ensure that they remain well informed. So this week, we will continue to focus on slowing the spread of the virus within our community. Obviously, that's the #1 goal, is to prevent the transmission of the novel coronavirus within our community. In particular, the Delta variant, we know, has been a significant agent that has impacted our community. The second goal this week is to make sure that our testing sites continue to operate 7 days a week in addition to our one-stop vaccination site. And thirdly, to encourage residents to participate in the upcoming county redistricting process, which begins tonight. So let me kind of back up to talk about what we're doing here within our community. I'm pleased to announce today that our 3 county-run testing sites and our vaccination site at Camping World Stadium have been extended. Since the last extension, we will add the opportunity to get tested and vaccinated through the month of October. So that is something new. We know our residents have been relying on these free services, and I thank our hardworking employees at Orange County Health Services for doing the yeoman's work of operating these sites now for quite some time, since March of 2020. With that, let me just get to the numbers at this point. Dr. Pino will get more into the granular detail of the numbers, but there are now some 223,339 reported cases of the coronavirus within Orange County alone. 223,000+ cases. The number of Orange County residents, unfortunately, who have died from COVID-19 has reached a new level. We have 1,877 reported deaths or fatalities due to the coronavirus, which is 13 more deaths since our last news conference this past Friday. Sadly, I do have to report that we have 1 additional county employee who died of COVID-19 on Friday, September the 17th. So in the midst of the misery created by COVID-19, we do have some good news, and that is that the 14-day positivity rate continues to decline. It is now 11.29%. So let's focus on that a bit. This is much better than where we were just not too long ago. At the beginning of August, you all may remember that for several days in a row, our positivity rate was at 20% or better. So we are effectively about half of where we were just a month or so ago. So we're trending truly in the right direction. Essentially, this validates that our strategy of driving up the rate of vaccinations and increasing testing and also returning to the wearing of facial coverings has worked. If we continue this trend, remember the goal is to get the positivity rate sustained below 5% over time. And so as we have now cut this rate effectively in half within the last month or so. I believe that as we continue to focus on getting individuals vaccinated, focus on continuing to get individuals tested, and if we continue to wear the facial coverings, we will get there sooner than later. Perhaps if we do these things, this will be the last significant surge of the pandemic. That 11.29%, I'm sure that Dr. Pino will continue to advocate and affirm that this is largely a pandemic within the unvaccinated within our community. So if we can get up or increase the rate of vaccinations, we all will fare much better in the coming weeks and months. The percentage of residents ages 12 and older who have at least received one dose of the vaccine is now at 72+% within our community. So I'm highly encouraged by that. This past weekend at our 3 testing sites, Orange County Health Services administered a total of 3,707 tests. So that's pretty good. As a reminder, 2 of the sites, Barnett Park and the former Claricona Elementary School, are open between the hours of 9 a.m. and 5 p.m. The Econ Soccer Complex is open between the hours of 9 a.m. and 4 p.m. To get information, go to ocfl.net/testing. And if you want to get information about the free vaccination opportunity at Camping World Stadium, remember we continue to offer Pfizer and Moderna at that location. It's open 7 days a week between the hours of 9 a.m. and 5 p.m. As I mentioned earlier, we are pleased to announce the testing sites and the vaccination site will be extended through the month of October. And let me talk a little bit about the redistricting effort. As you all know, in order for us to establish the district boundaries for elected officials, there's a process that is inclusive of getting citizen input in designing and assigning the districts to the various elected offices here within Orange County. And that process will begin tonight. It's based upon the 2020 census data. It is of utmost importance that our residents do participate in this process. The goal of redistricting is to review the population data and make potential recommendations to the Board of County Commission regarding the district boundaries. There will be a total of 11 meetings scheduled through mid-December. The first 3 meetings will take place here at Orange County Administration beginning tonight at 6:30 p.m. The meeting will also be broadcast on Orange TV, and if you want more information, if you want to participate in the process of designing maps, potential maps, you can go to ocfl.net/redistricting. And now, with that, I'm going to turn it over to Dr. Pino to kind of fill in the gaps, and then we'll come back and open it up for questions.
Good morning, Mayor. Good morning, everyone. Thank you for this opportunity. As you mentioned before, the total number of cases is at 223,339, and our 14-day positive rate is at 11.2. The number of deaths have increased to 1,877. Those are 13 additional deaths since we talked to you last week. 3 were female, 10 were male. Race, 1 black, 1 Asian, 10 white, 1 of other race. Ethnicity, 3 Hispanic, 10 non-Hispanic. 8 have underlying conditions. 5, we don't know if that is the case. 1 of the deaths is from April, 3 are from August, and 9 are from September. And none deaths were reported among residential facilities. 2 of the 13, that is 15.4, were fully vaccinated, and they were both over 70 years old. And 1 of the 13, 7.7, were partially vaccinated, 1 dose of the 2-dose series. None were past due for the 2nd dose. With regard to the infection itself, to the pandemic, the county is showing very good data, and we are heading in the right direction, as the mayor mentioned to you. Our incidence rate, remember, our highest was 640. Our incidence rate this week, or this past week, was 243. That means 243 positive cases per 100,000 individuals. Our number yesterday were 351. Although Sundays are not a good day for data, Saturday was 504, Friday was 651, and Thursday was 724. So the numbers are also declining all across. With regard to age group, 5 to 14 continues to be the highest group. It goes up and down, but it's now only 19% and not 25% of all cases, so that is a change there. Also, last week was the week with the highest reduction in the entire pandemic from a week to another week. So week 36 to week 37, the reduction in the number of cases was 30%. Weeks 36, we have 583 cases. Last week, we had 3,544. Our positivity rate, as I mentioned to you, continued to decline from 20. That was our highest to 11.2 today. And as well as our positivity rate for the day yesterday was 9.3. The total number of deaths in August has increased to 388. That makes us the deadliest during this pandemic. And we could see this number getting closer to 400 before the end of this month. The average age for those who have died is 69 years old for both August and September so far. The vaccination rates continue to increase slowly. Our 65 and older is at 85%. Our 12 to 17 is at 63%, which is a very good number. And we will continue to see increases. About 4% of the population who is 65 years and older have taken the 3rd shot, which increase our vaccination rates as well. Thank you very much.
All right, thank you, Dr. Pino. We'll open it up for any questions. If there's a need for translation in Spanish, we have Ms. Ilia Torres who will assist me in the process. We also are joined today by Commissioners Mara Uribe and Commissioner Maribel Gomez-Cordero, and Dr. Pino obviously is fluent as well. We also have our Director of Public Safety, Danny Banks, who joined us here today. So with that, we're opening up. The microphone is moving around, and it's over here in the front at this time.
It's Steve Hudak from the Orlando Sentinel. I'd like to ask this question of Dr. Pino. Dr. Pino, there's been some conflicting advice out there about whether people should get a 3rd shot. World Health Organization has said, hey, hold off. What do you say?
Well, I mean, we will always follow CDC guidelines and Florida Health. That means the Department of Health guidelines. I think we should wait a little bit. I know people are confused because there has been a lot of information released at the September 20th. Everyone 65 years and older, or everyone who was eligible, and that has changed a little bit since Friday. So we will wait for further guidelines. What is significant and different than when we were doing vaccination last year, at the beginning of the year, is that now the vaccine is everywhere. So it's going to be a lot easier for people to get access to that 3rd shot for those who qualify. And as we receive guidance from the state, we will start strategizing with the county on how to proceed and how to meet demand. We are meeting today in the afternoon just on that, how we are going to respond to the demand that it may create.
Lauren Seabrook, Channel 9. My question's for both of you all. With Pfizer saying that the vaccine trials went well for ages 5 to 11, I'm curious if you guys are working on a plan for, opening testing up for that age group once it is approved, and what that plan looks like, and if there's any plans to try to promote this among that age group any differently than what we've done.
So, well, the schools are a little bit different. If we are planning to offer the vaccines at the schools, of course, parents will have the right to take the child, whatever they want to be vaccinated, pediatrician or other providers around. But I think that what we have conceived so far includes vaccinating in the schools. We are in the process of securing probably close to $30 million for the next 2 years, 30 and 30. That will contribute to those efforts that we are with the school. We are in the initial phase. We are meeting with the contractor and the Department of the Board of Education, OCPS, to address those issues. So more news to come, but we are working on it.
The only thing that I would add is that obviously we have to work with the school district and the Department of Health, and really the plans will be based upon the supply chain. We at the local level unfortunately do not control the supply, and so depending upon how that is rolled out from the national level and the state, there's no question that the schools have to be central to that. But we have extended the vaccination opportunities for us through October, and if the younger children become eligible before the end of the year, we'll have to look at the opportunities and figure out how to partner with the school district, and we'll make contingency plans for how we may be able to continue to augment whatever decisions are made about where and who will have the supply. You've heard Dr. Pino allude to the fact that pediatricians in private practice will likely have access, and then there will be some other locations. So that is yet to be determined. So we continue with those conversations. We participate in the calls with the CDC and the Department of Health here locally, as well as with the White House policy office that has been working across the nation to ensure that local governments are kept in the loop.
Hi, all. Dave Puglisi with Fox 35, and this question's for either one of you. And I kind of wanted to build off the Pfizer topic a little bit. How important, or what would this mean for our schools if this was to get approved to be able to have vaccinations for kids 5 to 11 and ultimately keeping the community safe?
Well, having access to vaccines for that age group is going to mean the beginning of the end of the pandemic. Because when you open it up to a larger segment of the population, then we can really be more effective of interfering transmission. That's an important segment. It has been about 25 to 20% of the new infections. So if we are able to increase vaccination rates 5 to 11 to 70%, 80%, we'll be in good shape.
Oman Machuca, Telemundo 31. La misma pregunta, same question, about los niños de 5 a 11, y por qué cree usted que el índice de contagio entre estas edades es más alto, si cree que la situación en las escuelas podría incidir sobre esta situación.
So the same question before with regard to the 5 to 11 in Spanish, but also if I think the school's environment could contribute to the increase in infections in that age group. First in English. So that second part. The schools are not different than the community. The school is just another congregating setting. It's not different than barbershops, restaurants, sporting events. It's just a congregated, indoor, congregated setting. And I want to take stigma away from the schools and the schools and the schools. It's just another community setting. What is happening in the schools is that the age group that goes to the schools has no access to the vaccine. Therefore, transmission is likely to occur at a higher rate than other segments of the population. That's what we have seen. Entonces, con respecto a la pregunta en español fue de los 5 a los 11 años, ¿qué es lo que hay con Pfizer? Los datos están siendo revisados por el CDC y los centros que les dan consejería en estos casos. Y cuando sea la determinación, pues procederemos a vacunar los muchachos de 5 a 11. Lo más seguro es que ocurra en la escuela, pero también que ocurra con las enfermeras, los pediatras y, tú sabes, los otros lugares, Walmart, Walgreens, CVS, que están ofreciendo vacunas. Con respecto a tu segunda parte de la pregunta, si las escuelas tienen alguna situación especial que está favoreciendo la transmisión, yo te decía en inglés que no es que las escuelas sean diferentes que el resto de la comunidad, o un restaurante, o un lugar donde se hace deporte, es adentro, encerrado y mucha gente. Pues cualquier lugar de esas características va a incrementar la transmisión. Y también el hecho que los niños de 5 a 11 no tienen acceso a la vacuna. Pues con esto la pandemia pues tiene más libertad de continuar quemándose en los jóvenes de esa edad.
Okay, this is Melissa Thomas with Florida National News. This question is for Mayor Demings. Given the announcement of the unfortunate death of the staff member this past Friday, just kind of give us an update on how your staff as a whole is handling all of this, and how you're keeping the team together, the kind of things you're sharing with them to kind of keep everybody encouraged in this time.
Well, it's been a tough period of time for our staff as well as our entire community. We have embarked upon a campaign to educate our staff about what they can do to protect themselves, and we are using our physicians and other internal experts to help create various collateral materials that are being pushed out now to our staff about how to protect themselves. Number two, we're also making certain that our staff is aware of if they are feeling any type of stress associated with the pandemic, the resources that are available within our community to get help. We have a virtual component where they can seek mental health treatment. And then we have our traditional county services that can assist our staff. And I can tell you also that, it's a county family. We have tried to, while we've had some deaths, and you heard me mention today that we had one more death within our county family, we reach out to those families and try to do a number of things to make certain that they realize that their loved one is important to all of us. We even have a service that we offer to families where we plant a tree at one of our local parks in honor of that family member who has passed on, again, to show that we care about their loved ones and that they're just not numbers, but they are people who we care deeply about. And so we're going to continue. I will tell you that in terms of the vaccine mandate within our employ, that has been going fairly well. At this point, we have overall about 78% of our staff that has been vaccinated, which exceeds the rate in the community at 72%. When we look at our non-union employees, we have 81% of our non-union employees who have been vaccinated, and 63% of our union employees. We still have the one union that we're still in conversations with. So our employees have responded, I think, in a positive way, and some of that is because of the experience that they've seen. When you have coworkers who are being infected and who are dying, it has a different impact on you, perhaps, when it gets close to you like that. And then we have a significant number of our employees whose family members have been infected and are passed as a result of the virus itself. And so it is a real life experience for us that we have endeavored to humanize and not just look at it as if these are just numbers that no one cares about. We have, through these 157 press briefings, tried to make certain that we put a face on the numbers and where we could. You know, we've had individuals who've come and they've given various testimonials, but because of HIPAA rules, sometimes we just cannot identify the persons. But, you know, we've had some close calls as well, and we still have employees who remain hospitalized in critical care units, and we're trying to be prayerful about the recovery of those individuals. So that's kind of a general summation of everything that we're doing here within Orange County, and certainly we try to mirror everything that is going on in the community. We have used our various federal funds to help provide the funding to our social service agencies in our community so that they can respond to the community's needs as we have gone through this pandemic. Okay.
This next question is texted in from Rory O'Neill with iHeartRadio for Mayor Demings. The question reads, it looks like travel restrictions may be lifted for vaccinated Europeans. Is this a positive sign, and how important is it to get those visitors back in our hotels here in Central Florida?
Oh, we're excited about it. One thing that we know is that here in Orange County, we have been able to safely reopen with the various protocols that have been put in place, and our convention business is still fairly active, and the leisure business is still active as well. And so most of our travel into the area, you know, our airport has been the busiest airport in Florida of all airports, including Miami, and the travel has primarily been domestic. So with the potential expansion to the international markets, that is going to assist our economy well, I think, in recovery. People will not want to come here if they don't feel safe coming here. And so I look forward to our economy fully recovering. And last month, well, actually it was during the month of July that the controller reported that was the highest single month for tourist development tax receipts in the history of Orange County since we created the tourist development tax. So it surpassed any July, I should say, in our history. That was the highest month. July typically is one of those months that kind of takes a little bit of a dip, but it was the highest collections for any July in the history of Orange County. So all of that to me bodes well for our economy. We were one of the first areas, if not the first area, to open back up for conventions, and we did things like host the NBA and Major League Soccer in the bubble out at the Disney ESPN that set the tone really for how professional sports and sports in general would be able to regain competitive sports with fans in the stadium. And, you know, so I'm proud of that. And so even the international markets, this past weekend, FIFA, the International Soccer Football Association was in town doing a site visit for the potential for Orlando to be one of the cities in 2026 that will host the international soccer matches. And there was a great presentation by various entities here, the Sports Commission and the City of Orlando and other entities. We showcase what we have to offer here in the way of amenities. I believe that the feedback that we got immediately was very good. It's still a competitive process, and we're a long way from landing any of the games, but if we get multiple games here, each one of those games is like having a Super Bowl in your community, so it can have a significant economic impact. And all of that speaks to the international markets where our community is highly regarded around the globe as a desirable location to visit.
Thank you. This next question is for Dr. Pino from Ryan Lynch in the Orlando Business Journal. Dr. Pino, is there any expectation on how the current increase of travel may impact the positivity numbers during the holiday season compared to last year?
So that's an interesting question that I'm glad he asked, because I was planning to say this at some point if I have a chance. It was that this is the time right now to prepare for the holidays that are coming, meaning we are going to get a series of holidays. We are going to have Halloween soon, which has a lot of moving. It's short, but it happened, and it happens in an age group that is not fully access to the vaccine. So that's an important distinction there. And then we have Thanksgiving, and then we have Christmas. And after all those holidays, last year we experienced a significant increase on the number of cases. What is different is there was no vaccination that time. So we are not expecting that that would happen at the same level at all. But it's important for people to know that if you are planning to travel, if you are planning to congregate, if you are planning to see other family members that may come and visit, and you are not vaccinated, you still have time to be immunized by the holidays so that you are protecting yourself and protecting everyone and preventing these from becoming another wave. So with that, yeah, some level of concern. Of course, we are in a better position because of the vaccination rates, but we know that all that it takes is a variant that is more infectious than the one before to, destroy all your dreams that we were coming out of this.
And this last question comes from Scott Powers from Mayor Demings. He's from Florida Politics. His question reads, can you update us on the legal and practical statuses of the dispute with the governor regarding his threat to fine local governments over vaccine mandates?
We still haven't received any correspondence from the governor or the Surgeon General for Florida through the Department of Health. We haven't received anything yet, so we'll wait and see. I also want to point out that Scott Howard from the Orange County Public Schools did come in after we started. So if there are any questions for the school district, Scott is here now, and he could respond to any of those. Anyone have any questions remaining for the school district? Okay, I don't see any hands going up. So with that, okay, there's one in the back there. Okay.
This question is for Mayor. Mayor, I'm sorry.
For the school district.
Let's talk about the redistricting and how are you going to take the accountability about the Hispanic population in Central Florida?
Well, we have been very intentional in ensuring that through the Board of County Commission, the individuals that were selected to serve on the redistricting committee are very diverse. One of the co-chairs of the redistricting committee is Hispanic, Tico Perez. You want us to interpret it in Spanish also?
¿Desea la respuesta en español?
Sorry about that, man.
Sobre el proceso de redistribución de distritos, hemos sido muy intencionales con relación a las personas que se han seleccionado para servir en la Junta. De hecho, la persona que preside la Junta de redistribución es de ascendencia hispana, el señor Tico Pérez.
Secondly, we have 3 Latinas on the Board of County Commission who, through their advocacy of making appointments, they have appointed individuals who have been inclusive and will be vociferous advocates themselves.
Segundamente, tenemos 3 latinas en nuestra Junta de Comisionados. Ellas han estado muy activas y abogan por nuestra comunidad y han hecho unos nombramientos particulares de personas que representan la diversidad.
Thirdly, some of the redistricting meetings will be taken out into the community. So they will go into various areas of the county to seek community input. And then individuals can actually go on our website and use the technology by which to give input as well.
Tercero, con relación a las reuniones de la Junta de Distribución de Distritos, las tendremos a través de todo el condado para llegar a más partes de nuestra comunidad, así como también tenemos un enlace en la página web donde nuestros residentes pueden proporcionar sus comentarios.
Any of the collateral materials will be produced in multiple languages, primarily Haitian Creole and Spanish.
La mayor parte de los materiales estarán disponibles en varios idiomas, idiomas multilingües, incluido español y el criollo haitiano.
All right. Okay, any questions? I think, Scott, you got off free today. I didn't see any questions for the school district. All right. Now, thank you all for joining us. The next press conference is planned for Thursday, September the 23rd at 3:30 p.m. Thursday, September 23rd at 3:30 p.m. Thank you all for joining us. And by the way, the redistricting committee meeting is tonight at 6:30 right here.